following live video discusses some ideas and concepts that might be difficult to hear or process. If you need help working through these topics or situations, please reach out for help. The doors to the Student Development and Services Office are open. Due to the COVID-19 situation, Student Counseling Services is offering both secure video therapy sessions or in-person appointments if requested to support Nipissing University students. DBDAM provides specialized outreach, prevention, and intervention from an Indigenous wellness perspective. This includes events and activities to learn more about caring for your well-being. Any student may access these services, status, non-status, or non-Indigenous. Please contact us at counseling@nipissingu.ca or by phone at 705-474-3450, extension 4507. You can schedule an appointment with an available counselor or to answer any questions. In the case of crisis outside of Nipissing University Student Counseling Services office hours, or if you are outside of the North Bay area, you may contact one of the following helplines. These services are toll-free and available 24 hours a day, 7 days a week. Good to Talk Ontario's post-secondary student helpline at 1-866-925-5454. The crisis line at North Bay Regional Health Centre at 1-800-352-1141. If you are having a crisis or are in danger, call 911. Take care of yourselves and one another. Always recommend running an up-to-date version of Google Chrome when using Blackboard and Blackboard Collaborate Ultra.
Good morning, everyone, and welcome to our first live session broadcast over YouTube. I'm Rob Boulay. I'm here with my co-host, Chris Bird. Today we're going to be monitoring the chat, so if you have questions and that sort of thing, feel free to ask them. We'll give you a little bit of guidance later, but we want to make sure that everyone's aware of our chat etiquette. So we want to make sure that everyone's being respectful and that you have a pleasant tone and that there's no advertising. We also want to ensure that you adhere to Nipissing University's harassment and discrimination policies, as well as a respectful workplace and harassment prevention policy. We'll provide those links in the chat. If you have questions, feel free to ask them in the chat. Please put a Q in front of your question so it stands out for us, and we can identify that. And when we see that, we'll like it. If for any reason we are unable to get to your question because we run out of time or we don't spot it, we have a form that you can fill out. The link will be provided shortly that you can then use to create and submit a question. So even if you're watching this as a recording after the fact, feel free to use that form and submit some questions and we will get you some follow-up. I'm sure you've also noticed that Chris and I are both sporting some other than normal facial hair. For us, it's fitting for this live episode as we talk about trauma and mental health. So please take a moment and support and share awareness of mental health this month, as it is Movember. And you can find more information at the website, ca.movember.com. To start with, at the start of the semester, Chris and I were planning out our training talk episodes. And during our planning and discussion about what we were experienced over the summer and the spring, we saw faculty and students experience and a discussion with our coworkers. We noticed that there was a key item missing. Everyone was asking faculty and students to be flexible with each other without the discussion of the trauma that we're all experiencing during this global pandemic.
This is why we thought it was important to do this episode. We're not experts on the topic, so what we decided to do was bring in the experts and to allow you, our viewers, to hear directly from them. So we started out by reaching out to Dr. Sarah Driessens, Manager of E-Learning, who will be facilitating this conversation about trauma-informed pedagogy. Dr. Sarah Driessens, the Manager of E-Learning in the Office of the Dean of Teaching at Nipissing University, holds a Doctorate of Education from Nipissing University and a Master's and Bachelor of Arts in Sociology from Western University. Her teaching and research interests are grounded in equity, social justice, diversity, inclusion, and activist education. Welcome to the show, Sarah.
Thank you, Chris. Thank you, Rob. So great to be here with both of you today.
Well, it's great to have you. We really appreciate your time. I just wanted to start out by asking, can you tell us a little bit about your background in this topic and what you hope that those joining us today will take away from today's discussion?
Yeah, absolutely. So I think for me, the seeds of this topic really started during my time as a graduate student. So at that point, I was studying post-secondary student engagement or disengagement. So how prevalent is it? Why are students disengaging? Sort of what does it look like? And that ultimately really left me with more questions, as most research does. So I was wondering, as I moved into my PhD, what does engagement really look like, right? So can we assume that students who aren't reading, who aren't posting online, who aren't coming to class prepared are actually disengaged, or is there something more that's kind of going on that maybe we aren't seeing? So when I enrolled in the PhD in educational sustainability at Nipissing, it was really here that I started to rethink my own understanding of what does it mean to be an engaged educator, and really how can we shift our own thinking and our own practices around student engagement. So through my doctoral research with elementary students, and then moving into my own teaching career with pre-service teachers or teacher candidates, I really started to adopt this sort of relational approach to my teaching, right? So getting to know my students, creating a safe space for them to share their lived experiences, and then how I really had a responsibility to hold space for my learners, especially those who have been traditionally and historically marginalized and disenfranchised within the education system. So it was really through my own teaching and my own learning and my own doing that I began adopting some of these principles of trauma-informed pedagogy, but I really didn't even have a name for it, right? I was just adopting those principles. So in terms of what I hope folks take away from this discussion, and it really is truly that, it's a starting point for a larger discussion around trauma-informed pedagogy, and I hope that faculty who are tuning in are walking away feeling maybe better prepared, right, to infuse some of these practices into their classroom, whether that's online or face-to-face, because really, we know that students right now, especially post-secondary students, COVID is having a really deleterious impact on their mental health. And so we want to equip folks with the language, with the understanding to recognize some of these signs and these symptoms. So for students who are tuning in, I hope that they see this as I said, a starting point, right, to a larger pedagogical and institutional shift, where we really are all working together to promote some of these principles and bring them into our teaching practices at Nipissing University. So before we start, I wanted to begin today's session by, of course, acknowledging the land on which we are all working on. So Nipissing University is in the territory of the Robinson-Huron Treaty of 1850, and that the land on which we gather is the Anishinaabe people, and specifically the Nipissing First Nation. I'm working remotely, so I'm working in Huntsville, and I acknowledge that the area that I live and work in is the traditional territory of the Anishinaabe, specifically the Ojibwe, Chippewa, and Odawa peoples. This territory is covered by the Williams Treaty of 1923 and the J. Collins Land Purchase of 1785. And then finally, we also acknowledge the lands that we are all gathering and joining from today, working remotely. We respect and are grateful to hold this event on these lands with all our relations. We encourage you to find out more about the land on which you reside, and you can do this at visiting native-land.ca or whose.land. And if you want to just pop where you're tuning in from in the chat, we would love to hear from you as well. Okay, so today we are having an amazing conversation with two very brilliant faculty members at Nipissing University. So we are joined by Dr. Anne Wagner, who is an associate professor in the School of Social Work, and Anna Przednowek, an assistant professor in the School of Social Work. So thank you both for joining me today to share your knowledge about trauma-informed pedagogy.
My pleasure.
Okay, so let's start by giving some sort of a workable definition of trauma. So what do you mean by trauma?
So I can tell you that for the purpose of this conversation, we're adopting a deliberately broad definition of what we mean by trauma. So many of you may be familiar with the work of Judith Herman, who has written "Traumatic events overwhelm the ordinary human adaptations to life." So it may be rooted in individual experience, but it may also stem from more collective experiences. So, for instance, a natural disaster, and we'll talk more about the contemporary context as well. Also, there may be sources of trauma that are multi-generational. So it really makes us think about the scope of the trauma. Also, we're referring to experiences that may be rooted in broader systems or structures of domination and oppression that may result in experiences of trauma, such as racism, ableism, maybe cissexism, heteronormativity, and the list goes on. So we're trying to encompass anything within that framework.
So trauma may also result from prolonged experience of feeling threatened, from prosecution, potentially violence in the home, and experiences of bullying. Trauma may lead to feelings of powerlessness and feeling under dire threat as well, which is sometimes what we see some of the behaviors students exhibiting in the classroom.
Wonderful. Okay, so why then use a trauma-informed lens to teaching?
Educators should aim to reduce rather than increase risk of re-traumatization and secondary traumatization for students exposed to the course material. A central tenet of a trauma-informed view or lens is that individual safety must be ensured through efforts to minimize the possibilities of re-traumatization, secondary traumatization, or wholly new traumatization in the delivery of service, or in this case, it would be delivery of education. So as our universities are becoming a lot more diverse in our student population, we need to consider the student life experiences. Some of the students and their families may have been disproportionately affected by or experienced violence or marginalization. So for example, things like adverse childhood experiences, including trauma, abuse, poverty, including some of our students who may be current or former foster care youth. We also have a number of veterans studying with us who have exited military or retired from the military, are now engaging in re-education. We may have folks who identify as LGBTQ2+, and we know that post-secondary education is one of the first places and spaces where they begin to make meaningful relationships with professors and other personnel in terms of mentors, for example. I myself have had students who are both refugees and newcomers, and some of them are coming from countries or fleeing countries where they have experienced prosecution, war, and conflict. Many of us, especially at Nipissing University, we of course have a large population of Indigenous students who may have experienced both intergenerational trauma or as a collective community have experienced historical trauma. So unsurprisingly, students with unidentified learning needs who have not been accommodated or supported in the education system are also part of our student population. And some have had a negative association with education and learning because their learning needs or styles have not been supported or accommodated in their educational journey. So they come to us with a deep fear of learning, actually. And then finally, we have non-traditional adult learners, and these are folks who maybe for economic, non-material, or social reasons and barriers may have prevented them from accessing post-secondary learning much earlier in life. So these are not the students that are coming into school from high school right into the post-secondary education. They might be coming in later in life. So at the same time, I think what we want to do is be very cautious not to overgeneralize and label, right? We want to acknowledge the strengths and resilience that many of our students have developed in relation to the adverse life experience that they have experienced. And those are really important to think about and capitalize on, and really explore with students some of the coping strategies that they have used in the past in order to deal with those adverse experiences as well.
So if I could pick up on what Anna's saying, we're not necessarily focused on identifying particularly what form of trauma may be occurring in our classroom. Instead, what we're advocating is that we begin our teaching with the acknowledgement that these experiences exist in our classroom. So we need to prepare for that. We need to be conversant with how to structure our teaching in a way that can support students in that situation. So that's why we're suggesting the need for developing familiarity with a trauma-informed lens. And for myself, I know one of the things that I do is I don't use the language of trauma, but at the outset of a class, I acknowledge that people are going to be facing different challenges and that they may face different barriers as they progress through their studies. So by openly acknowledging it, what I'm also attempting to do is normalize it, so that students don't feel like they're uniquely disadvantaged or that this is something they can't talk about. It will put them in a negative light. So trying to open up that conversation early on and make students aware that I'm receptive to understanding that these things occur. So I also like to set the stage that if they are experiencing distress, it's not up to them individually to feel like they bear that entire burden, that there are supports, that I can be an initial support and that I can help them develop strategies to increase the likelihood that they're able to succeed in their studies and in my courses. But having said that, I don't want anyone thinking, oh my goodness, these two are social workers. Of course they can do that. I'm not in social work. What are you saying? I'm not a therapist. I'm not a therapist when I'm teaching either. I have very clear boundaries with students. So I also want to put out the message that I'm not suggesting, nor is Anna, if I can speak on your behalf, Anna, we're not suggesting that this is solely the responsibility of faculty. We need to think in terms of a campus-wide or institutional-wide response. And as faculty, sometimes we're in the front lines. Other times it may be staff. You may have a student that gets very anxious and stressed in the registrar's office when they're facing barriers, for example. So all of us need to be aware of trauma-informed responses. And we also need to be aware of the supports available on campus that we can refer students to. So if need be, we can offer suggestions to students of where they can go for more ongoing support.
That's wonderful. Thank you both. And I'm sitting here and I'm nodding and I'm agreeing with everything you're saying. What I really love, and Anne, you're picking up on, folks who are tuning in might feel like, oh, I'm not in social work, I'm in history, or I'm in classics, right? How can I come to this table and have meaningful dialogue or interaction? But I think, and I don't want to speak for both of you, but it's that key piece where acknowledging that our students don't enter our classroom as blank slates, right? And that they have experiences that happened in childhood. It may have happened that morning. And so it's about us as educators being aware, being responsive to that, right? And creating, as you're talking both so brilliantly about creating that safe space in the classroom so that they know you're receptive to it. And I love that language, right? That you're receptive, you hear them, you see them, you acknowledge them. So let's think then about sort of what our world looks like right now during the pandemic. So I'm sure that a lot of faculty, staff, students across every province and internationally are feeling this sort of impact. So in what way do you see this relationship between trauma and COVID sort of intersecting at this time?
So COVID can essentially be seen or considered as a disaster. So many of our students are losing their houses, their employment. They may be living in unsafe housing conditions. So we need to consider, if our students are not putting in their Zoom, for example, their video on their Zoom, that might be due to privacy issues as well. I've also had a student recently who had been doing office hours. He had messaged me and done office hours through Collaborate from his car. And he said, I'm really sorry, I have no privacy in my house. I'm doing my office hours from the car. And I was just really glad that he was there. So I reinforced with him, I'm just glad that you're here. I'm glad that you made it. Even if you're in a car, that's not a big deal for what we're doing here. Glad that you made it. So for many of our students as well, family members might be dying of COVID, but also family members may be dying in long-term care or hospital without any family support. We know that many of our students are currently going through many experiences of grief and loss, and of course those where they've had family members pass away, there is an overall lack of closure. Many of my students actually in social work, but I suspect in other disciplines as well, are currently working in essential jobs, essential service jobs, and especially places like such long-term care. And we know that long-term care has been disproportionately in the social media, and some of the tensions in long-term care have been exposed or discussed in social media lately. Finally, many of these issues may lead to an impact on mental health. And in a typical disaster, such as a hurricane, for example, the recovery process begins much quicker than for us under COVID, which has now stretched over a span of 7 or 8 months.
And if I could add to that, in terms of anticipating when these issues might arise, I think we need to acknowledge that we can't always anticipate what might be unsettling or triggering for everyone at all times. So just because we're talking about a particular subject, for instance, doesn't mean someone will or won't be triggered. So again, I get back to my earlier point about establishing those expectations at the outset. So letting students know that it's not unusual that at some points you may be feeling overwhelmed, or you may be triggered, or you may be feeling emotional. And we can give them some ideas about how to cope with that, or what is appropriate in our classroom. So for instance, something very simple that we can do at the outset, I always like to acknowledge you're adult learners. If you need time to gather yourself, if you need to step outside of the classroom, please do so. Don't raise your hand. There's no need to ask for permission. You do what you need to do. I'm not going to think less of you for that. So just giving some predictability and, again, normalizing the situation for students that this may be occurring or may occur. Another instance in which people may be triggered or experience intense emotions are during discussions, even in class, in any class. So there may be a statement made that they experience as being very oppressive, for instance. And this is to be expected. We're all learning. We're all formulating different thoughts and working through them. So if that happens, I think what's integrally important is our role as faculty. How do we then intervene in that situation? How do we mediate, or how do we respond to that instance? So acknowledging that that happened and opening it up to a little bit of exploration and understanding. One of the tactics I often use is saying, well, it's interesting that you frame it in that way. And that is something that oftentimes we come to believe. And why is that? What's going on more broadly that we come to that understanding? And how do we understand that that might be oppressive to someone else, to people in, with different standpoints? And have a conversation about that, guiding the conversation and reframing, but not letting it go. So acknowledging what has been said and reframing in some way. So I think we have to be prepared to challenge, and then also debriefing that process is part of it. So rather than being accusatory and putting people on the spot for having said something that may be perceived as oppressive, rather contextualize that so that people aren't then afraid to come to voice in the classroom or are afraid to contribute to conversations?
So I really like this idea of not letting it go, though, that Anne, you're talking about, right? So these types of conversations can be uncomfortable, right? They can cause discomfort in ourselves as educators, in our students. And so I think that piece about, not letting it go. How can we create a learning environment where students don't feel as though they can contribute, or alternatively, that students feel like it's an accusation, right? And I think that takes time. It comes back to that relational piece, right? So getting to know your learners, creating a space in which where we can all come to an argument, a discussion, a conversation, and be valued and be heard and be respected. The other piece that you're talking about, and that has me thinking, is this idea that you mentioned. I'm not going to think less of you if you stand up in the middle of class and go into the hallway, or if you're doing a synchronous session, turning off your camera for a few minutes just to have a moment, right? Regroup, whatever that looks like for you. And I think that the bigger piece is that overarching, stigma that's still attached to mental health. And we are, I think we're slowly shifting where it is more normalized, as you're talking about, right? I really love that language. So normalizing it. But I think it's really important during COVID, especially, that we recognize and we create a space in which students can self-advocate, right? So that they can say, hey, I'm feeling triggered, or I'm feeling this way. I need to take a moment. I need to step back, and that's an appropriate response, right? Rather than, as you were saying in the beginning, Anna, sitting there and feeling compelled to feel re-traumatized. Like, why would you need to do that? It's okay if you need to take that step back, right? And so I really love that you're both bringing, sort of those best practices to share with the group today. So thank you. Then I'm really interested to know how trauma looks like. What does a student trauma response look like in the classrooms? And can you give some examples that you've seen in your classes or that you've experienced yourselves? What does it look like to you?
And I'm glad you asked. Oftentimes, it looks very much, we may interpret it as disengagement, lack of interest. So students may have difficulty focusing, or attending, remaining present, psychically, retaining information or recalling information. May also result in missing classes. We may also see it in terms of challenges in establishing positive relationships, even with peers. So they may appear reticent to get involved in group work, to work collaboratively, for instance. In some instances, it may look like anger, having difficulty regulating one's emotions. So it may come out as very strong reactions that seem disproportionate to what's going on in the moment. Or it could look like hopelessness, this sense that nothing they can do will make a difference. So what we may be interpreting often as maladaptive behavior may actually be survival skills. This is what people have used to cope.
So students may also become upset and may skip class. This may happen due to the lecture or a larger class discussion. Sometimes when these conversations are mishandled or ineffectively, such as classroom exposures and disclosures, they may in turn cause students to do poorly, miss classes, or drop out. Students also experience fear of taking risks, so they just get blocked and they experience a fear of taking risks. Some may experience anxiety, some may experience withdrawal and isolation. The one thing that I think is important to mention and get us to think about is information that we include as part of the content, but just thinking up and not necessarily thinking about the content within the classroom itself. So for example, some of the clinical courses in social work obviously have content that's related to trauma itself. So I'm currently teaching a course on risk resiliency and complexity. So that signifies to student that we're likely going to be talking about difficult topics and difficult content. Next semester, I'm teaching interpersonal and structural violence, and that would be another content or another topic that would or even course title that would signal for students that the topics that will be covered in that class may be difficult. And we know there is a number of different content and courses across the university and the various disciplines in the university curriculum that may explore these topics as well. But sometimes we know that students may not be aware of that these discussions of traumatic content will be included as part of the course, the university content or course content until they take the actual course. There's often no mention in both the course description or even course syllabus that you will be covering difficult course content. And that's also happened to me before, where in my early teaching days, where I didn't include any information in the course syllabus. And it wasn't until week 3 or 4 that we had explored topics of trauma. And then I had students come up to me and say after that if they knew that we were going to focus on issues of trauma, they probably wouldn't have taken that elective course to begin with. So knowing who your students are. So when discussing content, consider that the students sitting in your classroom, you may be actually be talking about their or their family experiences. So for example, in my international social work class, we discussed experiences of refugees, and there was an exercise, simulation exercise that students had an option to take in order to bring some of these issues into their awareness. But students had a choice whether they wanted to participate in that or not. In another class, a theory class that I taught, while the focus and majority of the content actually focused on talking about resilience and resistance, and I really took that lens into it, and we still discussed difficult content and difficult topics such as history of residential schools or missing murdered Indigenous women, and these were likely the experiences of many of the Indigenous students that were in my classroom. Something that we may not also think about is the content of student presentations. So again, this has happened a couple of times within my classrooms where students got triggered by the content of the presentation of another student, and they had left the classroom because they became upset. And we know that these topics, especially when we're discussing topics such as social injustices or human rights violations, these may be difficult topics for some of our students to view or to listen to in that way. Sometimes, as much as we try to control all of the information, we know that sometimes these discussions happen both in class discussions between students, which of course you then have to moderate, but on occasion these conversations also happen in the periphery of the class, if we can call it that. So they can happen on break, and on a few occasions I would see a student and they would be fine before break, and then after break they would be missing for a few minutes, or they would be visibly upset. So I had some reasons to suspect that maybe something happened over break that brought them to that, and essentially they were upset in that sense. So some of the other things I think when we're thinking about cross-disciplinary and curriculum across the university. One time I had a guest presenter who did a wonderful, amazing job of discussing history of art class. And the presenter had the lights turned off for the presentation. And in the presentation, they focused on art history, which is so amazing, and took a lens of discussing issues of adversity, prosecution, and violence in art. And after the presentation, as exciting and important that presentation was, students had reported that both the combination of turning off the lights and also the difficult content of the presentation itself, the visual content of the presentation, wasn't necessarily something that they were prepared for. And then some of the other examples that I have are thinking about novels. So we know, for example, in women's studies and gender studies, in literature, and even in other disciplines, and certainly in social work, we quite often use novels to discuss and bring up issues, especially when we're thinking about issues facing marginalized populations, because of course these are not the conversations that we should be putting on our students within the classroom. So we bring those conversations in other and different ways. And we know that some of these experiences of diverse populations who experience marginalization and violence and marginalization are part of their everyday lives. So while within the content of the course and the actual focus of those novels was to pay attention to issues of resiliency and resistance, the response of resiliency and resistance was to adverse life experiences, which some students found really difficult to read in that sense. Another place that we often don't think about that is actually of special interest to me is research. So students may be engaging in research with marginalized populations and vulnerable populations. And while explicitly they're not studying issues of trauma, they may not be prepared for or know how to read the cues sometimes and know when not to open a box, and somebody might be sharing their own experiences of trauma just as part of the narrative, as part of the research interviews. So this is something I think is important to have as part of conversations with students, that while and prepare students for that, while that is not the focus of their interviews, it may be that these things come up in conversations. So also giving students the tools to know how to manage those difficult conversations when they do come up, and sort of put the conversation sort of back together, and doing things like taking breaks with the participant, etc. And having obviously access to supports and resources if the conversations unravel and both the participant shares experiences of trauma, and of course the student is privy to those conversations as well. And then finally, just to get us to think about that, the course content that can cue students' traumas, experiences, and lead them to disclose, invited or not invited, of course. The instructors and many of us as faculty are often ill-prepared or not prepared for having those discussions. So I'm hoping that what happens is that this video or this presentation contributes to people's sort of increased knowledge in those areas.
And I too have sort of been in that situation where like something that I just was not prepared for, it triggered someone. And I love this idea of taking great care, right? And I think back to Nell Noddings and the ethic of care, and sort of how can we layer that caring element into our pedagogy and into our teaching practices. And I love too the idea of using literature. So that's part of my research, and sort of how can we equip even the youngest learners with some of these ways of thinking around challenging conversations, like racism, sexism, so on and so forth. So I think using literature it can definitely be triggering, but also it does create opportunities to sort of have those conversations with students, and to sort of walk a mile in someone else's shoes that has lived a different life than we have. So you have brought so many really amazing ideas to this discussion. What advice would you have for faculty then who are not trained in mental health and they don't feel adequately prepared to address issues of trauma, or even to field some of these conversations right inside their classroom? Do you have any best practices, tips that they could bring into their teaching?
Yeah, so I think one of the things that Anne had talked about before, which I'm hoping that we all sort of take note and build on, is to include the students as part of the process of the learning process. So we want to work towards building strategies with students as well. And I think we always want to convey the confidence in students and their ability to learn, because sometimes, of course, we know that students are feeling anxious, they're feeling discouraged. So we want to ensure that we are building confidence in students and their ability to learn. I think where possible, try to build in choices and options. So I often say to students, depending on the topic, you can keep the conversation at the heading level without going into the details level. And even within the current online learning environment, when I am sharing topics and webinars, for example, I even write sort of in the description of the webinar and say, this conversation can have difficult content, but the content is at the headings level. But there's on occasion also webinars or content that students may be learning or reading or viewing where I say this content is at the sort of details level. So students have a little bit of preparation in terms of that as well. Thinking about the other pieces I quite often pick content that's external content that has both PowerPoints potentially or a transcript, which offers the students an opportunity to read the content as opposed to watch the content, because we know that we process information differently when we read it versus being exposed to it visually in that sense. And of course, the different senses that get activated within that process as well. An easy topic, quite often, especially in the upper year students, so I'm thinking of my fourth year students, I offer opportunities for students to pick, to take up a lot of their learning on their own and take up focus a lot more on self-directed learning, or so students pick topics that are relevant to them, and even within that process, students may choose not to focus on topics that are traumatizing or too difficult for them in that way.
Some other thoughts that I have about supporting students, and of course it's more challenging in this time of COVID where we're teaching online, but checking in with students if we learn that either they're feeling unsettled or they're unusually disengaged, maybe. It's much easier, of course, in person, because you can do it much less formally, catch them on their way out the door or in the hall or what have you. But also for our own confidence, I just want to reinforce the value of knowing what supports are available on campus. So that, again, reinforces the pressure we often feel that we have to do something for these people who are struggling. So knowing where to refer them for more in-depth or more ongoing support, potentially. However, whenever we offer these options, I think it's also really, we need to be careful in how we do it. So acknowledging that a big part of trauma is feeling like you have no control. Control has been taken away from you. When we provide these options, we want to make sure we're providing choice. This might be something you want to consider. Would you be interested in hearing more about? So again, that's not disempowering the individual. And it's also not giving them the message that I think you're struggling to the point that you really need help, which is a very disempowering message. Instead, we're sharing information with them. So again, seeing this as part of an institutional-wide initiative, so not taking on that burden. And by framing it in that way, I think we also avoid one of the difficulties, which is sometimes not maintaining clear boundaries. So we want to be really clear that we're not doing for students, we're supporting them, we're providing options to them, and we're offering information, but we're not going to overstep and become their sole support. That's not our role as educators. So we always want to give them the message that we have confidence in them. We can help them develop strategies to succeed rather than becoming reliant on us.
So and I love that sorry, go ahead, Anne.
I was just going to say conveying hope and also demonstrating respect, I would say, are key to our approach.
I think that's great. And there are so many great elements layered into that, but that idea of empowering students, right? And I think the other piece is recognizing that you as a faculty member or anybody else are not the sole person who is responsible for accepting that onus onto you to solve this problem or to work with this student. Again, that working together collectively as an institution, through Nipissing is really, I think that's critical. And the other piece that sort of you're layering in, and it seems fitting, especially given that most of what we're doing is online these days, recognizing that disengagement might be more than just not showing up, right? Because they are disengaged, because they don't care. Perhaps getting out of bed that day is just too hard, right? Sitting in front of their computer to write one more discussion post is just too hard. And so coming to your teaching, coming to your class through that lens of care and compassion and kindness, and recognizing that I have a lot of conversations about accountability and how do we hold students accountable during asynchronous learning, during online learning. And I guess maybe the bigger question is, do we need to be holding them accountable, or do we need to be doing those check-ins that you're talking about, Anne, right? Like checking in with those who are disengaged to see if more is going on. And sometimes maybe just that one quick check-in, whether it's an email, right, or you respond to their discussion post or whatever it looks like, is enough to sort of bring them back to the table, to be ready to learn. So the final question then that I have for you, and to wrap up today's session is, and I think you've already provided a lot of really great strategies and practical examples, but can you share examples of practical strategies employing a trauma-informed lens?
Yeah, so for me, I think picking up on what you had just mentioned, Sarah, is the participation activity. It just made me think of how I talk to my students about hard deadlines versus soft deadlines, and a participation activity in my class has a soft deadline. So I expect that most students will submit their work by Mondays by 12 p.m. But I also have the flexibility to say, if you need that extra hour, if something happened on the weekend and you can't do it by 12, this isn't something that I need you to stress over. Please submit it as soon as you can. So, and I find with teaching about 110 students, my students have not been taking advantage of that. So most have been submitting their work on time, but knowing that if something happens in their life where they need to have the extra hour or that extra afternoon, this is something that that is accommodated. And they're very gracious, and they still let me know, even though that there's the policy in my class, they still let me know that, hey, I've just submitted something late, I'm really sorry about that. So, but more generally, I think that's just a simple little thing that I was just thinking about in terms of online teaching and COVID right now. But just being aware of the broader contemporary context and all of the challenges that students are facing right now. So housing, isolation, as we talked about, online virtual environment. Sometimes we may be asking and feeling like students should be turning on their Zoom or collaborate videos, but many students have said, I live in unsafe housing, I lack privacy in my home environment. I had a student do a collaborate office meeting with me from their car because they said, I don't have, I'm not safe, or I can't do it in my home environment, so I have to do it from my car. I'm like, of course, makes sense. Whatever you can do. I'm glad you're here. Glad you made it to office hours, of course, right? So recognizing how widespread trauma is and resisting doing further harm, I think that's probably something that we should all keep in our mind. I always talk to my students about collective care, this notion of collective care, and that can be taken up in different ways, but things like no sense, for example, within the classroom environment, that in itself can be triggering to some of the peers within the classroom. For me, I always ask permission before I turn off the lights for the students, like when we're watching a video, for example, or I ask if it's better if I only turn half the lights on, and most of the time the half the lights situation seems to work for the students. I remind students that it's everyone's responsibility in the classroom to consider what information they share and for what purpose. Are we sharing this information for learning? Or are we sharing this information to be sensational? And there's quite a bit of difference in terms of the impact and the purpose of that. And also thinking about, this is something I learned from my supervisor in my PhD, Dr. Susan Braley at Carleton University, which I really loved because she was one of my teaching mentors, was I had struggled with these difficult conversations and students reacting to difficult material with during my PhD time when I was learning how to teach. And she always sort of taught me and really instilled in me to build in content that also discusses how people are organizing resilient, how people are being resilient, and how people are resisting, because that really promotes hope in students. So quite often I do in my classes a midterm check-in, and once in a while I'll have a student saying, the content in this class has been a little bit depressing. So what does this mean and how do we move forward? And that is often my cue that I have not been necessarily including that component of organizing, resisting, and resilience. So it's a good reminder for me to get back on track and course correct in order to do that.
I'm nodding along in the background here because I get the same feedback that sometimes I depress my students. I think just another thought I have is oftentimes I'll build in opportunities in my courses for students to also share their strategies, because I also want to give the message that they don't only need to rely on us. This whole notion of collective care, what can we do to encourage that collaboration and that sense of support among students? So I may even throw up a question on the discussion board, for instance, about let's share strategies. What have you been doing that's worked for you? And again, I just want to go back to the whole notion of normalizing that challenges are to be expected. They happen to us. There's nothing wrong with that. And also by setting out expectations for students about maybe what they can do if they find themselves in that situation. So I talk about not withdrawing and the need to reach out for support. And one of the valuable things about putting it out there and being public at the outset of a course is setting out your expectations in that way are also a good way of building relationship and establishing trust, which is critically important when you're dealing with students who've experienced trauma. So I think I'll just leave it there.
Yeah, I wanted to just add a couple of points in as you're talking. Is one of the things that that often you and I think in conversation with Sarah had talked about is this isn't necessarily about sanitizing information either. This isn't something that we're going to avoid having conversations, difficult conversations or difficult topics. So certainly one of the things that I really appreciated, I went to a conference, white privilege conference a few years ago, and Dr. Wanda Bernard presented a presentation on brave spaces. So rather than thinking about safe spaces, which of course we still have to do when we thinking about trauma, but in having difficult conversations, she talked about having braver conversations. And I thought that was such a powerful message. So how do we engage students to work through some of those challenges and support them so that they can sort of come out on the other end of those conversations? And certainly that happens a lot, and students can be really challenge their own beliefs, ideas, and can come out have some transformative experience, if I can call them that. I think also Dr. Melissa Redmond has a really great article on a safe space oddity, and she really talks about this pedagogy of discomfort, again thinking about students learning through some of their discomfort. And again, I think we have to be cautious and differentiate between trauma and just having difficult conversations, but quite often these can be interrelated in that way as well. We know maintaining healthy boundaries and modeling healthy relations. So if we have students who have had challenges in their past or adverse life experiences, and sometimes challenges within their own family relations, and they may in our classroom environments engage in those what we would call maladaptive behaviors, right? We want to ensure that we're holding ourselves accountable and that we're modeling healthy responses, right? And that feeds into that social emotional learning of our students. Practicing cultural humility when we're working with students from different ethnocultural backgrounds. So in constantly evaluating our own knowledge and skills, acknowledging power imbalances, committing to respectful, humble, and sincere collaboration with our students, I think is also important. And as Anne has mentioned, and I think we're going to have a slide with some service and supports at Nipissing University. So at the institutional level, offering both supportive counseling services, but also support for academic success for our students, which are really of key importance as well.
Amazing. Yeah. And I love this idea of creating brave spaces. That's a new term to me, but I think it really is about having, because you're right, Anna, these conversations and many other conversations, they're uncomfortable, right? And sort of how can we lean into that discomfort as educators? How can we support our learners to do the same? And I think it comes back to what you're talking about too, Anne, which I agree is critical in all learning environments, but maybe even more so in the online realm now, is that establishment of community, right? So how do we create a community of learners who are open to having challenging conversations, who are vulnerable, right? Who take risks? And I think it really is about establishing trust. And that is more challenging in the online realm, but it's not something that we can't do, right? It's not something that we can't establish. And I love this idea of you said it, Anna. I'm glad you're here, right? I'm glad you're here today. And I think that might seem really small to us, but it can go such a long way for our learners to recognize that you care, right? You're happy to see them. And anytime I have had like even email correspondence with students, I'm so glad you reached out, right? And I think that is really critical right now, and sort of whenever COVID ends, we don't know, right? So really honoring that they're showing up. And thank you for sharing that with us. I feel like we could talk for hours and hours and hours, but I recognize the value of both of your time. So I just want to check in with Chris and Rob to see if there are any questions for Anne or Anna. Perfect. Well, if you out there, whoever's viewing this at any point in time, have something that you want to connect with any one of us about, please feel free to do so through that form. But honestly, Anne and Anna, thank you so much for having and starting, I think, one of many conversations. It is truly transformational. I like that term, Anna. I think that learning is transformative, right? And so I hope that this is really a catalyst to a bigger, larger institutional conversation that we get to continue having now and in the future. So thank you both again for sharing your collective wisdom with us. It has been a great honor to have this conversation with you today.
Thank you.
Yeah.
I think it's needed.
I agree.
Beginning, it's our first time going through a live session, and we appreciate both your and the audience's patience as we work through a few audio issues there. But thank you very much for this chat. It has been very enlightening, and I can't thank you guys enough for taking the time to speak with us today.
Well, it was a pleasure. I will do it anytime.
The following live video discusses some ideas and concepts that might be difficult to hear or process. If you need help working through these topics or situations, please reach out for help. The doors to the Student Development Services Office are open. Due to the COVID-19 situation, Student Counseling Services is offering both secure video therapy sessions or in-person appointments if requested to support Nipissing University students. DBDAM provides specialized outreach, prevention, and intervention from an Indigenous wellness perspective. This includes events and activities to learn more about caring for your well-being. Any student may access these services, status, non-status, or non-Indigenous. Please contact us at counseling@nipissingU.ca or by phone at 705-474-3450, extension 4507. You can schedule an appointment with an available counselor or to answer any questions. In the case of crisis outside of Nipissing University Student Counseling Services office hours, or if you're outside of the North Bay area, you may contact one of the following helplines. These services are toll-free and available 24 hours a day, 7 days a week. Good to Talk Ontario's post-secondary student helpline at 1-866-925-5454. The crisis line at North Bay Regional Health Centre at 1-800-352-1141. If you are having a crisis or are in danger, call 911. Take care of yourselves and one another. Always recommend running an up-to-date version of Google Chrome when using Blackboard and Blackboard Collaborate Ultra.